Flu season, when it comes around, two groups are always more in danger of developing the virus. It's very young and older people. The CDC reports this year that we've had 63 pediatric deaths linked to the flu, highest hospitalization rate that belongs to seniors. So how do we keep safe? How do we keep our loved ones safe? Christy Etheridge has been looking into that, and she joins us live. Christy?
Hey, Melissa. Yeah, when it comes to the elderly, preparation is key. Obviously, the best thing to do is to keep them away from any flu germs at all. AG Rhodes is the oldest nursing home in the city. It serves about 1,100 people a year, and they know every year that the flu season is going to roll around. If you were to stop by there today, the first thing you would see is a sign telling you to stop. It says people who aren't feeling well, it says you need to go back home. Come visit your loved one another time. But if you do make it inside, if you're feeling okay, you'll see hand sanitizer stations all over the place, and then flu masks for people to wear. All of the employees there are required to get the flu shot. But even with all of that, it is really hard to stave off the flu.
While we have had some cases of the flu, we really have been able to contain those cases, which is really a testament to our staff and to people in the community who, if they don't feel well, they're staying home.
Georgia's flu season still has not peaked yet. That news tonight from the Georgia Department of Health. So how can you help keep your family safe? Christy Etheridge has been digging into that question for us tonight. Christy.
Vinny, every year we know two groups are more at risk for the flu, the elderly and young children. But this season, even adolescents with seemingly healthy immune systems are dying from the flu, proving no one is safe from it this season. The moment you walk up to the door at AG Rhodes Nursing Home, a sign will make you stop. It warns if you have as much as a sniffle, turn around and go home.
When you're healthy, we love to see you, but not only for our elders' safety and well-being, but for our staff, because our staff are giving that one-on-one care.
AG Rhodes is the oldest nursing home in the city. It serves about 1,100 people each year, and every year since they started in 1904, they've had to battle the flu season. Like these hand sanitizing stations, you'll find them everywhere. They also require each employee to get the flu vaccine, and those who can't wear a mask.
The elderly are a more vulnerable population, and so when you introduce something like the flu, that can do a lot of damage to someone who's older versus someone who's younger and healthy.
But even that doesn't protect you from the flu. A seemingly healthy 15-year-old boy died from the flu on Sunday. It's the third pediatric death in Georgia so far. So why are healthy kids dying from the flu?
Oftentimes, adolescents in particular may not be as quick to seek health care. They may not be observed by their parents as closely as younger children might be.
Dr. Andy Shane works at Emory and Children's Healthcare of Atlanta. She says we assume a kid's immune system is healthy, but that's not always the case, especially if they have an underlying condition like asthma. Plus, they may not always tell you the moment they start to feel bad. But she said there is one pattern she's starting to see.
Between 75 to 80% of the flu deaths that we know about in children this season, those children had not received an influenza immunization.
So influenza A is starting to die down, finally, but influenza B likes to peak early to mid-March. The only good news about that is that the vaccine tends to help prevent against that one even better.
All right, thanks so much, Christy. You know, we have a guide with everything you need to know about the 2018 flu season right now on 11alive.com.